This is the common, generally they do have, and also due to that reason spleen get splenomegaly, excessive spleen malfunction, which is controlling organ is spleen, that is spleen also having the impacted. So now we understand due to that reason she has shortness of breath or breathlessness. Right, all are connected to this, and due to thyroid also, pericardium is weak, then sometimes it causes to the thyroid issues, maybe, may not be, but however chances are prominent. So now according to now the kidney pulses are weak, then you shouldn't say that your kidney pulse is weak to the patient. Now we can, even for you, no problem, we can say that intestine you have the problem, you have the gastric problem is the common problem today. We put a word is not harmful. That's what we are telling, that there is a problem in your brain, there is a problem in that. So big organs we shouldn't say. Liver problem hai, okay, you can say fatty liver. The way you are expressing to the patient is very important. Oh, aapko fatty liver aita nimke. ಅದೇ ನಿಮ್ಮ ಶುಗರ್ ಇಷ್ಟು ಜಾಸ್ತಿ ಆಗಿಬಿಟ್ಟಿದೆ. ದ ವೇ ಆಫ್ ಎಕ್ಸ್ಪ್ರೆಷನ್ ಇನ್ ದ ಎಕ್ಸ್ಕ್ಲಮೇಟ್ರಿ ಲೆವೆಲ್ ದಟ್ ಕಾಸಿಂಗ್ ಯು ದ ಪೆಥೆಟಿಕ್ ಸಿಚುವೇಶನ್ ಟು ದ ಪೇಷಂಟ್. ಏನೋ ಸ್ವಲ್ಪ ಆಯಿತಾ ಅದು ಫ್ಯಾಟಿ ಲಿವರು, ಬ್ರೈನಲ್ಲಿ ಕೂಡ ಏನೋ ಸ್ವಲ್ಪ ಸಮಸ್ಯೆ ಆಯ್ತು, ಅದೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಿಬಿಡೋಣ ಬಿಡು. ದ ವೇ ಎಕ್ಸ್ಪ್ರೆಷನ್ ಬೈ ದಿ ಡಾಕ್ಟರ್ಸ್ ಈಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ದಿ ಪೇಷಂಟ್. ಸೊ ಹಿಯರ್ ಈಸ್ we are serious or not serious, that is a different thing. But we don't put a word your kidneys are weak, right? To the patient specifically, so that really having the great impact. But they don't have the kidney problem, but the kidney essence and the chi is deficiency, because inheritance chi is not given by the original energy is not derived much. And of course is the lifestyle modification also somewhere is mistake or genetically get impacted about the parents or the ancestors who have the family history. Chances are there. In this case that also we cannot avoid. You just check with her, and she consumed 10 idlis, she consumed 2 idlis, right? You just give the delicious Ananda Bhavan Adayar's idlis and she'll eat 10, if I am not wrong, certainly, but she cannot take 3 idlis. Then who is obese, you can see now. Now we shouldn't blame that she has the obesity, means ಏನು ತಿಂತಾಳಪ್ಪ ಹೇಳ್ಬಾರ್ದು ಆ ಥರ, ಹೌದಾ ಇಲ್ವಾ? So it all depends on the genetics also. So she do have phobia as well. Because of the kidney deficiency, then phobia also is there. What I told you, how we should express that if the kidneys are weak, we should mention kidneys are governing to the scalp hairs. Kidneys are governing to the bones. Kidneys are governing to the ears. Kidneys are emotions are reflecting to the fear. Kidneys mother is lungs. Kidneys grandmother is spleen. Connect in this way. Muscular system is deficiency or the over function of the muscles or the skin dryness or the lungs getting the problem, right? And the bones getting the problem. And then your emotions are impacted by the fear. Sometimes you feel inside there is a ringing sounds or some kind of the issues inside the tympanic membrane. There is, you can put a word, you have the hair fall. Again you say the kidneys are related to the menstruation cycle for the woman. Mention that your cycles are really not precisely good. Don't I'm not blaming you, I'm giving you examples, okay? You say lie all that time, okay? You say no, okay?
I'm happy you saw my hand today.
Okay, so in this way we analyze the patient and then put a word. And then if we don't want to ask to her also, we don't want to ask, but being she is in front of me, I should listen to her. My name also, what's my name? Tell me both of you. Then what is the meaning of my name? Ab sunna nahi kya mama? I should listen. My name itself to listening. So I should listen, right? Sunto nahi sunto main. Kab tak tumhara nahi sunta main. So the people who come to me, then I should listen so that they feel comfortable. But whatever I listen, really I am telling you, they tell me many things. but I take it to my mind. But what I see, I do the same. What I do the job is my job only. This I have seen, I know the category and then everything internally. But I wanted to do that. My job is just do the needling to that particular organ. This also I'll tell you, 3 needle technique I'll tell you. At last the senior will be benefited. Right? So in this way I diagnose it. Today we are talking only diagnosis, but the therapeutics I'll tell you in the short and sweet after seeing to all the patients. Right? So hopefully not the patients, of course. So you tell me honestly, I've forgotten your Sveta, no? Savita, yeah. Savita, tell me honestly about what I predicted. Really, is it, do you get the headache and then cervical pain, and sometimes of course is the bones also, joints, you will get the problem, acidity and gastric problem also you feel, and the cycles about it, and then hair fall and thyroid related issues. So tell me what are the things you do have.
Thyroid is not confirmed, sir, but rest all is good. I am taking treatment.
Okay, so now this is enough. This is the one evidence. Perhaps she didn't say lie, right? Okay. Okay, please be seated. Yeah. Come.
What about the muscle cramping? So what cramps will come? Cramps.
All are connected to the, again, it is stagnation of the spleen. Yes, yeah. So make sure this the bangles or the whatever they have the knots and then threads, they are they are keeping, they should remove, and then especially the bangles also not so good. If there is a gold bangles, ask them to keep it in there itself, and if somebody kept and somebody took, that also will be the problem. First pulse, no pulse. Second pulse.
No pulse at all, sir. I know, sir. You tell me that.
Then why are you here?
I am checking you, sir.
Now open your mouth. Yeah, I'm actually silent. Now I'm talking. Okay. Good. So while seeing the pulse diagnosis is not advisable to talk each other, and patient also shouldn't say their complaint, and I should also not ask any question. I shouldn't talk to you also. So in this way now, according to her pulses, of course, you understand almost all the moderate obesity. That means their BMI is more than 29, 30, 32, and their both of BMI is I think above 30. So which causing the young pulses are of course is the deficiency, right? Due to that reason they feel abdominal related. When you feel there is no yang pulses, make sure they do have the gastric related issues as well, right? So yang pulses are weak, then there is all the fu viscera is normally not all the patients having the weakness. Some patients who have very emaciated body or the atomy, so even for them is not causing much problem. But for the obesity patients, they do have the gastric issues. And apart from that, also I feel most of the women, according to my clinical experience, most of the women are getting the problem connected to the triple warmer, pericardium, kidney pulses are weak. Kidney yin, kidney yang, both the pulses are normally get deficiency, especially for the women. Especially for the women. So we normally see around 10, 20, 30 different types of the pulses, which among them major trouble spots are known as the pericardium, and then kidney pulses are getting deficiency.
What
So
is the reason, sir?
yeah, I told you this morning. So there's so many factors which reflecting. But however, there is the cervical related issues. Why does it causes mentally strain, stress, and working pattern is not really good, and day-to-day life is not really sound, and sleeping patterns are not good, emotionally getting impacted. And also people work with the, today normally these women are not using phones. So due to that reason also getting pain, right? So of course these are the things. And apart from that, after the menopause, generally will get, or during the menopause or the pre-menopause, also chances are there where the vitamin D absorption will be very poor to them, and then vitamin B12 also deficiency, which causing these problems as well. And hormones get impacted, of course the estrogen and progesterone not regulated precisely, that also reflecting to cause many factors, right? So I request to all of you, please now, as you have seen right now, I just asked to randomly, sir ನೀವೇ ಹೇಳಿ ಪಲ್ಸಸ್ ಬಂದು ಫಸ್ಟು ಸೆಕೆಂಡ್ ಥರ್ಡ್ ಎಲ್ಲೆಲ್ಲಿರುತ್ತೆ, ಇದು ಮೇಲ್ಗಡೆ ಇರೋದು ಎಲ್ಲಿರುತ್ತೆ, ಗುಡ್, ಎಲ್ಲಿರುತ್ತೆ, ಇಲ್ಲಿ ಎಲ್ಲಿರುತ್ತೆ, ರಿಸ್ಟಲ್ಲಿ, ಫಸ್ಟಲ್ಲಿ, ವೆರಿ ಗುಡ್, ಫಸ್ಟಲ್ಲಿ, ಸೆಕೆಂಡ್ ಪಲ್ಸಸ್ ಹೊಟ್ಟೆದು, ಗುಡ್, ಥರ್ಡ್ ಪಲ್ಸಸ್ pelvic organ. Now he understand means everybody has understand, right? Sir आप बोलो first second third segment में कौन से pulses are existing. Now we lift the hand, we come to know the first segment is upper. Yeah, first segment is, tell me the name of the organs.
Lungs and heart.
Yeah, lungs and heart, wonderful. Then middle segment,
Stomach and spleen.
stomach and,
Spleen, liver, gallbladder.
very good, wonderful. Then the third pulses are
Kidneys.
very good. Now this always you should keep it in your mind without any confusions. If this is clear, then only once you place ಇಲ್ಲಿ ಲಿವರ್ ಇರೋದಾ ಸ್ಪ್ಲೀನ್ ಇರೋದಾ ಕನ್ಫ್ಯೂಷನ್ ಇದ್ದರೆ ಗನ ಪ್ರಾಬ್ಲಮ್ ಆಗಿಬಿಡುತ್ತೆ, ಹೌದಾ ಇಲ್ವಾ? ಇಂಟೆಸ್ಟೈನ್ ಇರೋದಾ, ಸ್ಮಾಲ್ ಇಂಟೆಸ್ಟೈನಾ, ಲಾರ್ಜ್ ಇಂಟೆಸ್ಟೈನಾ, ಆ ಕನ್ಫ್ಯೂಷನ್ಸ್ ಇರಬಾರ್ದು, ಸರಿನಾ? ಬಟ್ ನಾವು ಬೇಸ್ಡ್ ಆನ್ ದಿಸ್ ಪರ್ಸ್ಪೆಕ್ಟಿವ್, keep seeing the pulses, no naughty pulse, no hasty pulse. I'll tell you the differentiation. 3 pulses we should be very careful. 3 pulses we should be very careful. Number 1 is the hasty, the second one is the knotted, and third one is the intermittent. 3 pulses, keep it in your mind. 1 is the knotted, hasty, intermittent. What is hasty pulse? Hasty pulse is the rapid intermittent pulse. Rapid intermittent. You just open around 1,000, 2,000, 3,000 diseases are there. Now all the diseases are different, but when we bring to the acupuncture and the natural medicine, all comes under the vata, pitta, kapha.
Yes, sir.
All comes under the 5 elements, fire, earth, air, water and wood. But wherever whatever disease is there, thousands of diseases which bring to only 5 elements only. Now we understand, if you wanted to treat the spleen 3, one particular point, according to Dr. Wu Wei Ping, he said it is 16,000 diseases can be treatable by using the one single needle. I don't believe, you also don't believe. By the way, we believe at least 16 diseases it goes away. 16,000, you take off that. 16 diseases. At the last moment, at least you believe one disease it goes away. We can eradicate to one disease for the one single point. Then you assume one point also having the therapeutic effect. If you applied precisely with the proper anatomical location, and also if the diagnostic part is good, then certainly having the great impact to treat any foot problem or the head problem or the finger problem or abdominal problem. So one is spleen 3, you remember. So this is in fact hundreds of the diseases can be treatable by using the single point, I mean to say. If you add up, that is LU9, so you can 100 diseases. You can add up the kidney 3 or the K7, hundreds of the diseases can be treatable, because the medical dictionary it says is the thousands of the diseases. But whereas we do have 361 points. Among them the points are only 60 command points are there. In the 60 command points are the ruling points in our body system. How the Raja is the ruling, king is ruling the world level. So in this way, this acupuncture points also to be considered as a ruling point in our body. So therefore, whatever there are the problems are existing, irrespective of the problems, if you diagnose is precisely, the body is showing me this pulse to be activated, do your job. Then the healing properties to be taken place not with you. This you remember, I connect to Almighty, so it's not my job, I have done my job. Now job is to be done through your hands. Is healing power to be in your hands. I ask to Almighty God, Almighty, you send to the patients to me only that can be treatable through our hands. Which cannot be treatable, please don't send to our center, that our name shouldn't get very bad name. So in this way I pray to God, at least you send me whatever it is possible. Now you send to me, then your duty to give the healing properties to the patient also. It's not my duty. But if I mistaken, then of course it's my negligence. If my negligence is the improper knowledge is there, improper knowledge is not good to treat the patients. But with the knowledge, with the great knowledge I am treating to the patient, but this much only I can do. Remaining rest of the things is in your hands, and kindly forgive my sinners and forgive the patient's sinners, and then give the healing properties to the patient. That's what I pray to the Almighty. At the same time, because of that, Alhamdulillah, people are benefited, and then whether they are getting cured, but I think in the different level. What is the another next solution? If one treatment is not affected, I'll think in the different level. If the second level is not affected, I'll think to the micro level. If the micro level is not affected, then I think about the scalp level. If the scalp level is not affected, I'll think about the auricular level. If the auricular level is not affected, I think about the clinical level. Clinical level is not affected, I think about the classical level. If this also not happen, I will think and take the support from the modern medicine which related to the medicine. I'll take the support. If the support is not given by the medicine for last emergency, then I'll ask them to go for the various specialization where we could not able to do that. No, better you can go and approach to the further super specialization. Doctors are existing, better you can go and meet to them. Right? Convince them to send to their proper place. Don't take it on your head all the time. You come and I'll do. But I'll see your psychology. I'll see the patient psychology. If the patient is comfortable, he is telling, Dr. Saab, I came 3 times and I couldn't got any relief. I got the pain on my right side, but after taking the treatment, it is affected on my left side, also affected the pain. Now we understand his views are different. His thought process is different, but he is not comfortable with our treatment. Then Naiji, you come down, I'll treat you. That goes away. Again we are charging also, we are taking money also. With great difficulty he is paying the money. He is not comfortable to giving money to us. But however, because of our pressure, we don't give pressure. At the same time we never ask, even motto is here, where we are not asking to anyone to pay the amount. We don't say that you shouldn't ask. If the patient is giving, should collect it. If the patient is not giving money, go and asking. We ignore them. No, he has forgotten. He is not willing to give. Ignore it. We don't want that kind of the money. Happily somebody is giving our fees, consultation. For the last so many years we never collected the consultation fees till today. So we take only with the treatment, and without the treatment just people are talking and taking our time. We don't ask anything. Giving the certificate to them for the sickness certificate, fitness certificate, we never collected the single NP from the patient or from somebody. This and all is against the ethics or with ethics, I don't know. My mind says, my heart says, I shouldn't take it any money. Then we don't take it any money. Of course, we are giving, they are giving to us, we are getting enough money. So that's quite enough. And normally, your money is my money and my money is your money. Something, if the wife get conflict in between, then I said, my money is your money is your money. Then she'll be happy. Right? Sometimes we are angry. That time, your money is your money, my money is your money. That gets the conflict, right? So however, all money matters is not the everything. But of course, money is totally different. Happiness is very crucial, right? So hopefully, what's the time now?
5:30, sir.
5:30. So rather than taking the break, I would like to wind up. I think so that would be better, since you people told to go for the very long destination. So we'll do the prayer later also in a few minutes. So anyone, now we'll take another maximum 10 minutes. We do have the time to prayer, and then we'll do later, and then we'll finish it up little early so that the people can go. Next time we will keep in the mind, and Nagamani and other Rekha madam told that we should finish it off little early. That also better, so that every people, the local people also come to the classes, right? So I think few of the slides are there or not there, I don't know, just I need to check. But however, do you have any further doubts, and please let me know.
Should we administer any of every points that we look at?
Yeah, it is really good question. How many minutes we need to keep the retention of the needle? See, now it depends on the condition to condition. Normally for the paralysis patient we keep 1 hour also recommended, or the whole night also recommended. Only for the paralysis or the neuro related disorders or the respiratory related problem. So once we inserted the needle, we are in the home, anyone patient is there, we insert the one needle is the Shanzang and put it the plaster, let it, they can lie down aram se. Then they wanted to play, let they play. They wanted to sleep, they can sleep. That can be possible, right? LU 9 point is there, we can place it the whole day, let it be there. Whatever they wanted to do the work, let they work by using the Vaccaria, semen Vaccaria sagittalis seeds, called as the ear seeds are there, no? That seeds to be placed on the LU 9 point for the respiratory problem. You just place it here also, one bindu, especially on the REN 17. Let it be there for a day or 2 or 3 maximum. How the auriculotherapy also we can place some of the on the pressing needles or the pressing seeds. So that also place, we can place it that. Yeah, pressure. Ask them to give the pressure. Patient itself keep giving the pressure every now and then, right? Number 2 is, when we wanted to use in the classical way, when I wanted to activate one particular needle, I wanted to insert the mother point. Once we do that needling, so let it be there maximum 20, actually scientifically 28 minutes and 29 seconds are recommended. But however, it is recommended as a mother point 20 minutes minimum you can keep it. So maximum is 30 minutes. Otherwise you wanted to use as a very minimum 2 to 3 minutes you wanted to place it, or insert the needle and then, so I'll show you that how to do that procedure for the tonification and then sedation. That would be better, right? So by the way, I just changed this. Okay, give me your hand. See, I wanted to use as a LU9. So I just applied the LU9 as a tonification. right? Just I applied as a tonification. Now just applied as a towards the energy flow. Just I have given the energy and think this could be enough. Then I just do the some stimulation and then close the hole. Just given the stimulation, I just activate it and then I just close the hole for few seconds and then you just relax. Then we have given the tonification to this particular point. So once we wanted to sedate for the H7, that is the Shenmen, I wanted to use as a sedation. I just applied anti-direction of the energy flow as a H7 point. Then this H7 point is there. So just I do some sedation, withdraw the needle and then make that hole remains the same. This sedated. This is sedated. So in this way, when she don't have the problem, for example, when heart is sedated, that means is the low energy, the excessive energy was there, I sedated. Now she don't have the problem, that means no excessive energy was there, again I sedated. If it is sedated, that energy will going to sedate rapidly. Of course it sedated timely, then again it go back to the reverse direction, that energy is received again on the same direction. That means it doesn't get energies drastically because acupuncture works on the bio and negative feedback, both the mechanism to be taken place, right? So in this case, if it is required, that will accept. If it is not required, that will get neutralizes. That's called as a acupuncture modality, right? So tonification also to be done for fraction of minutes and sedation also to be done fraction of seconds or the minute.